breast cancer death rates have dropped 44% since 1989, and that's not a coincidence. On this Mindful Monday, Dr. Hope Guzzo is here to talk about why early detection saves lives. Good morning, Dr. Guzzo.
Good morning. Thanks for having me.
Yeah, thank you so much for joining us. So October, as many people know, is Breast Cancer Awareness Month. So why is it so important that we talk about this topic?
Yeah, I think October is just a great time to raise awareness, and because breast cancer touches so many lives, and I think, you know, knowing that 1 in 8 women will develop breast cancer over their lifetime, but also remembering that catching it early is great, and we can treat it very well if we catch it early. And so I think having awareness this month, you know, has people pay attention to their bodies and know when things are wrong, and gets the patients to come in earlier.
So what's been behind the success?
Yeah, I think a couple of things. I think one is screening, starting screening earlier and encouraging screening at the age of 40 for women. Also, I think just advances in surgical treatment, medical oncology treatment, and radiation. All of those things have led to improved success and decreased death rates for breast cancer.
So what are the early detection steps that every woman should be taking?
Yeah, so I think starts with screening. So yearly mammograms starting at the age of 40 for most women, but also remembering if you do have family history or other risk factors, sometimes that means screening earlier. And so I think just you know, talking to your primary care doctor and letting them know what's going on in your family or in your own personal health, so that we can tailor those screening recommendations if you need to come in earlier. And then I think also just paying attention to your body and knowing when something's off, and if anything's bothering you, please, you know, let your primary care doctor know, and we can get you in.
So this can also include men or women as well.
Correct.
And so what are the signs, as you just mentioned?
Yeah, I think for both men and women, it's important to know, you know, new nipple discharge, new skin changes, swelling in one breast, a new lump in your breast or under your arm. Those are all signs in men and women. I think many men don't realize that they also can get breast cancer, and so if something feels off, something looks off, you know, those are things we'd like to catch early and get you in to be screened.
And is there anything that we can do for prevention?
Yeah, I think there are some things, you know, we can't prevent all breast cancers, but I think, you know, maintaining a healthy, active lifestyle, getting physical activity, eating a healthy, well-balanced diet, minimizing alcohol use, and not smoking are all things that every person can do to help reduce their risk.
For sure. And you kind of mentioned earlier, so many men don't know that they're also at risk for this, and this week is actually Men's Breast Cancer Awareness Week. So what should men know about breast cancer?
I think honestly just knowing that they can get breast cancer. I think that's probably the biggest thing, and if something feels off, something looks off, they're having nipple discharge, anything like that, you know, saying those things early and letting people know is probably the biggest thing. There aren't any screening guidelines for men, but just awareness, I think, of their body is probably the most important thing.
For sure.
And just remember, it's important to get yourself checked, because just don't be a tough guy. Just go and see the doctor.
Absolutely.
Right.
Yeah. And for people who, you know, may be affected by this themselves or have family that are affected by it, you know, what is something that you think that they should know for this journey going forward?
Yeah, I think just knowing that there is a village around you, that there's so many people out there that have been through this and walked this journey, and that everyone is, you know, there to help, you know, take you along this journey, and that it is very treatable and curable for most people, and the outlook is very good.
And that early detection is huge.
Absolutely.
For sure. Well, Dr. Hope Guzzo, thank you so much for joining us. We really do appreciate it. This is such an important topic. It affects so many people, as you mentioned, and so many in our community, so really do appreciate it. Thank you.
Thank you very much for having me.
For sure. All right, and we will have more news ahead after this.